Hello everyone, welcome back again. DangTeach at CCSD. Just a few more items left until we are done with phase 1. Phase 2 will be loading up assignments, and then I think phase 3 will be going live. Alright, today's lesson, parenterals. So we're talking about sterile formulations. We'll talk about large volume parenterals, small volume parenterals, laminar flow hood, and then we'll get into aseptic technique. And then for next time, we'll cover the remaining learning objectives. All right, things given injectable. So don't forget intravenous push and intravenous piggyback. They need to be free from bacteria and other microbes. Of course, we know why. Because those routes, they're going to bypass our defense system and get right into the circulatory system, so they can go anywhere in our body. Any other routes that might need to be sterile? If you think about it, where don't you want microbes like bacteria, fungus, and virus? Yep, in the eyes, nose, lungs. So those items, try to keep them as clean as possible. They may not need to be completely sterile, but at least sanitized. Some special precautions. So we'll talk more about the actual process aseptic technique next time, but make sure it's free from any particles. So if it's a clear solution, put it against a black background. If it's a milky solution, put it against a black background just to see if there's anything floating. Blood pH is 7.4. Can't really range away from that too much, or the range is very small. So if you're below or too high, then the body will shut down. So you can't put things that are too acidic or too basic and change the overall blood pH. Next is osmotic pressure. So this measures, well, we'll just call it how much stuff is in blood. So there's cells, blood cells, proteins, salts, sugars, a bunch of other molecules. So that's going to impart about 300 milliosmol of pressure. So things that we add to the blood must have about the same amount of stuff in it. So the two most common are isotonic. That means they're balanced with blood. Dextrose 5% and NS, which is 0.9% sodium chloride by definition. So those two are the most common solutions because they are isotonic. Hypertonic, things like D10, 10% dextrose, or 70% dextrose, are way too concentrated for blood. And hypotonic, things like water, or half NS, quarter NS, will have less than 300 milliosmoles of pressure and can damage the blood cell. Regulation for sterile compounding. So USP Chapter 797 will outline all your requirements, and Chapter 800 will outline all your requirements for hazardous substance compounding. Everything that you make must be labeled as sterile or compounded sterile preparation. So if it's not sterile, then it would be adulterated and mislabeled. Other things to consider, strength. So if it calls for NS and you put it in half NS, that would be a strength there. If it called for 100 mLs and you put it in 50 mLs, that would be a volume error, content error. And then there's things called endotoxins. They usually cause fever. So they're also called pyrogenic agents, things that causes fever. So that could be not a living organism or just part of its cell wall or any substance it may produce and then cause a fever. All right, large volume parenterals. So we'll go with the book definition. Anything 100 mLs or larger So usually our IV solutions come in these common sizes. There's also in-between sizes. Note we have an add port, and this port here is for the IV set. So make sure that cap is there to maintain sterility. Small volume parenterals for us, that's going to be anything under 100 mLs. So we got mini bags. So we have NS 50 mLs, D5 50 mLs. Ampules made of glass. We'll need to break them at the neck before we can withdraw the contents. Pre-filled syringes. Sometimes they're called pre-loaded syringes. We got these vials here that will require this device, the Tubex, to dispense the contents. And then vials with rubber closures, like these guys, most common. So they come in single dose or multi-dose. And the difference is preservatives. The multi-dose vial will contain some preservative that the patient may be allergic to. Here's that fancy word again. Lyophilized, that just means freeze-dried powders. So before this drug can be administered, it will need to be reconstituted. However, upon reconstituted, some of these drugs have a very, very short lifetime. You have to infuse it within 1 or 2 hours. Otherwise, you got to throw it out. So what we can do is delay the reconstitution by adding the drug to the appropriate IV solution, but without reconstituting the powder. When it's necessary, the nurse will then go ahead and reconstitute the powder and administer that to the patient, hopefully saving a lot of wastage. All right, let's identify if the following solutions are hypotonic, isotonic, or hypertonic. Half NS. So that is 0.45% sodium chloride. That would be hypo. Remember, NS is isotonic, 0.9%. D5W, that is the other isotonic solution besides NS, D5W. How about D70? That's going to be way too much, so hypertonic. Sterile water for injection, there's nothing in it, so 0 milliosmoles. That's definitely going to be hypotonic, very dangerous. It'll cause your blood cells to swell and burst. Seawater, seawater is about 4% salts, so that's way more than that 0.9 sodium chloride, so that is going to be hypertonic. Quarter NS, just like half NS, less than NS, so that's going to be hypo. And lastly, for fun, coconut juice or coconut water was actually used as emergency IV fluids. So for our purposes, we'll just call it isotonic. Has some salts, sugars, and it is sterile. All right, some definitions. Let's see if you guys recall these terms. LVP, SVP, large and small volume parenterals. D5W, dextrose 5% W, and remember that is isotonic. USP, United States Pharmacopoeia, just like an encyclopedia, but for drugs, so pharmacopoeia. CSP, everything must be labeled as such if it's sterile. SDV versus MDV, so the difference is preservatives. So we got single dose vial and multi-dose vial. So single dose vials would be preservative free. NS, 0.9% sodium chloride. Na is sodium, Cl chloride. And then sterile water for injection or irrigation. So into the body, into a vein injection for outside the body irrigation. All right, a couple more definitions. Oh, wait. Let me know if these are large volume parenterals or small volume parenterals. So for us, remember, our cutoff is 100 mLs. So ampules, little glass ampules will need to break. We'll discuss how to withdraw those contents, the contents of ampules, next time. Those are tiny. They're going to be way smaller than 100. TPNs, total parenteral nutrition. So all your food and nutritional needs for the entire day definitely is going to be large. Mini bags kind of gives it away. So they're 50 ml or 100 mLs. LR1000, that's way bigger than 100. NS250, way bigger than 100. So if you guys recall, LR is lactated ringers. It is an isotonic solution. It's an electrolyte mixture as well. PLS, pre-filled syringes or preloaded syringes, way less than 100. Powders for reconstitution, for our purposes, they're usually going to be less than 100. We're not talking about the large bulk bottles. And then vials with rubber closure, same thing. We're going to be working with the smaller vials, less than 100. All right, let's get into TPNs, one of the most dangerous medication you can have. And that's because there's so many chances of contamination. Many ingredients, way more than 3. So this is getting into the medium risk category. So we have your macronutrients. So you need dextrose, sugar for energy, fats, and protein. So if it contains all 3, sometimes they'll call it a total nutrition admixture. You'll need your electrolytes or your salts. So things like potassium, calcium, vitamins, and then your trace elements are your minerals or your metals. So if you take a look at this image, you'll see that there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 potential ingredients that will go into this bag. That means there's 11 potential chances of contaminating this bag. So next time we'll talk about what we do to mitigate that risk. So since they are going to be highly concentrated, hypertonic, we need a large volume of blood to dilute it out. So a central venous catheter may be installed. So it's under the clavicle, under the collarbone. Or they can insert a PICC line, a peripherally inserted central catheter. And all that is they connect a tube where the TPN will eventually be administered at the central venous catheter site. A lot of times you'll use machines to help. So here we have, looks like the hyperformer for the base solution. And this might be Clindamix for the additives. Other solutions that will need to be sterile. Peritoneal dialysis. So if you don't have access to hemodialysis, where they take your blood, filter it, and reintroduce your blood back into yourselves, we'll need to filter your waste in your body through the peritoneal membrane. So in your gut, in your abdomen area, you'll have the peritoneal membrane, and we'll infuse a very, very hypertonic solution into this cavity. And what that will do is it'll draw in water, and with that, toxins. And then we'll rinse that fluid and repeat. So that peritoneal membrane is taking over the function of your kidneys, filtering the toxins, the blood, and the water in your body. And then irrigation solution. So we'll have bladder irrigation sometimes. It's continuous, usually with NS or half NS. And of course, cleaning outside of the body and instruments. All right, so getting into the equipment needed to maintain sterility, we're going to compound within a laminar flow hood. So because of pharmacy compounding and usually the length of storage, at least 24 hours, we'll need to compound within a laminar flow hood. So laminar just means parallel currents of air, just like laminated pieces of wood. And that flow is going to help sweep out any contaminants, any particles that might be in the environment. So that clean environment is produced by a HEPA filter, high efficiency particulate air filter. And that is being pushed through at a constant rate to maintain that laminar flow. And within that hood, if you take a sample, that is 1 cubic foot, you should have no more than 100 particles, 0.5 microns. So that is the English classification, class 100. The metric is ISO class 5. So class 100, ISO class 5, they're going to be used interchangeably. So the operator will be right about here, and the only thing that enters the hood would be their hands. You want to keep your head out of that front edge. Different variations. We have the vertical flow hood. The only difference is the air is coming from the top down, and it could vent towards the operator, or it can vent through the work surface. And then the operator wouldn't worry about it bouncing off their surface. Zone of turbulence. So we can't see the airflow, but as an analogy, you can see the flow of water as a boat moves through it. So along the sides, there's laminar flow. Well, towards the back side of the boat, you have the wake. So that's turbulent flow. You want to make sure all your manipulations occur within laminar flow. So don't put one object behind another, and make sure you don't put them too close together, because that would increase the zone of turbulence. Chemo and other hazardous substance will require a class 2 biological safety cabinet, BSC. And the only difference is there's a little bit of vacuum pressure. So actually some room air will be sucked in, but most of the air will be recycled through the system and eventually vented to the outside. But as the operator, you won't be exposed to any potential toxins. Cleaning the hood. So if you ever turn it off, you'll need to let it run for 30 minutes before cleaning it. You want to clean from top to bottom and from inside to out. So mostly that's cleaning from your clean area to your less clean area. Certified semi-annually, that means every 6 months. And most likely you'll do some in-house testing just to make sure it's operating maybe on a daily or weekly basis. All right, a TPN. Is it small or large? All your nutritional needs definitely is going to be large. So if it's large, the route most likely is going to be IV. So what's the verb for IV? Yep, it's in a bag. It'll be infused. Are TPNs isotonic, hypertonic, or hypotonic? So we need to administer them at a central venous catheter, large volume blood to dilute out the high concentration. Can insulin be added to a TPN? Do we give sugar in a TPN? Yeah. Is there going to be sugar in the blood? Yeah. But there's nothing to stimulate insulin production. So the act of chewing, the presence of food in the stomach will stimulate insulin production. But if we're injecting sugar straight into the veins, there might not be any insulin available. Which type of insulin can be infused? So most insulin, or actually all insulin, must be given subcutaneously, except regular insulin. It's the only insulin that can actually be infused. Can we add antibiotics to a TPN? Total parenteral nutrition. Is nutrition, well, is antibiotics used in nutrition? False. So antibiotics is used to treat infection. TPN is used to treat your nutritional needs. HEPA. High efficiency particulate air. How often are hoods certified? So twice a year, every 6 months. So that is going to be semi-annually. Define class 100, ISO class 5. So the volume is per cubic foot, no more than 100 particles, and the size is 0.5 microns. IPA, that's rubbing alcohol, isopropyl alcohol. And that's what we use to clean the hoods. The strength we use gives us the appropriate evaporation time to kill and sanitize. That's 70%, just like normal rubbing alcohol. For chemo, we need a biological safety cabinet. All right, one last item before we conclude step 1. So you can't just put your hood in any corner of your pharmacy, any closet. You have to put it in a class 10,000 room. So if you work in biotechnology, most of your clean rooms are going to be class 10,000. The metric is ISO class 5. So similar. So the volume of air is 1 cubic foot. This time you're allowed 10,000 particles, 0.5 microns. And of course, we want positive air pressure. So you're going to put your hood inside your clean room. And if you open the door to your hood, you want clean air to rush out. Hence positive pressure. Unlike the biological safety cabinet, you wanted negative air pressure. You wanted the chemotherapy to be sucked in and stay inside the cabinet. A buffer zone. So before you step into the clean room, there's going to be a before room, an anti-room. And that's usually a class 100,000. That way you have a little bit of space before you enter into the uncontrolled area. All right, not bad. That concludes part 1. We'll talk more about aseptic technique and how to compound in part 2. Once again, thank you everybody for joining us. We just have a few more lectures left, and then all of the pharmacy lectures are posted. Thank you, and you guys have a good day.